Well, let's switch gears a little bit, and I want to really dedicate a good portion of the show to the situation in Haiti. And joining me now to take a look at the situation is Dr. John Carroll. Dr. Carroll is a physician in Peoria, Illinois, and he's been working in Haiti for the past 35 years. He runs a not-for-profit called Haitian Hearts, and essentially they bring Haitian children back to the U.S. for heart surgery. So, Dr. John Carroll, welcome, sir, back to the show.
Good evening, Robert. How are you?
So glad to have you on. When I made the arrangements to have you come on the show, I don't think we had any idea concerning the hurricane. And so that's a little bit more added stuff to discuss today. But what I want to do first, Dr. Carroll, is, many in my audience probably have a very superficial knowledge of Haiti. They see the stuff on the news, the little several second clips of the devastation, but they don't really know Haiti. So
right.
I want to really go ahead and give you a chance to change that. Can you give us an introduction and tell us about the country, the people, the economy, government, and I'll give you the floor for a period of time.
Well, thank you, Robert, for this opportunity. And anytime you need to interrupt me, you can.
Okay.
Haiti is located several hundred miles from Miami. It's really not far from the United States at all, and it occupies the western one-third of the island of Hispaniola. The other part of the island is the Dominican Republic. And I have a lot of bias when I talk about Haiti. My wife and I adopted a Haitian baby from Port-au-Prince about 10 years ago. He's doing great. And so Haiti is a big part of our lives for so many reasons. Main reason being its people and our son, for example. But as you alluded to earlier, just in the last few days, there's been a massive hurricane. Hurricane Matthew struck southwest Haiti. Really, it struck most of Haiti, but the southwest was most hurt by the hurricane. And there's just been an incredible amount of damage to the Southwest Peninsula. I've been getting texts and just got off the phone a few minutes ago with the Haitian. The damage is great, and it's going to take a long time to recover from this, days, weeks, and maybe years, actually. So, do you have any specific questions regarding this latest disaster, meaning Hurricane Matthew?
Yeah, absolutely. I guess what I would like to get from you is, with all your experience in Haiti, what do you see as the short-term and the long-term effects from Hurricane Matthew?
The short-term effects from Hurricane Matthew will be access to these villages and to these cities in the Southwest Peninsula that have been hurt and are isolated. And people right now are without food and without water. And they've been that way for a couple of days now. I just got off the phone with a Haitian friend of mine, and his family lives in a little village in southwest Haiti, not just north of Lacaille, which is the third largest city in Haiti. And there's around 600 people in their village, and their house did not fall in for some reason. They have 4 or 5 little rooms, and there's about 200 people to 300 people that are in and out of their house all day long. They have 10 bags of rice and some oil that they're sharing with the people of their little village. I just got off the phone also, actually not off the phone, off of WhatsApp texting, a physician in the hospital up in the mountains. And they have 80 people in the hospital. They're locked in. They're isolated. They can't get down the road. The food's running short in the hospital. The water, of course, is running short. There's water in the hallways of the hospital, which made it hard to even function today. This afternoon they did a surgery on an abdomen, a laparotomy, most likely for an emergent reason. But in other words, these villages, even the bigger cities are isolated. Jeremy, which is on the western tip of the island, is essentially destroyed. So it's a terrible event that's happened. And long term, it's going to be to try to reestablish the roads, the bridges that have fallen in. This was harvest time in Haiti right now, and so a lot of the food has been destroyed that would have been harvested, and so that can bring on famine. And then standing water, of course, can bring on the mosquito-borne diseases and just the waterborne diseases as well. So we're just starting this devastation as far as I'm concerned, Robert.
Right. And it just seems like that country just never seems to get a break. It's one thing after the other. Now, because this radio show is primarily focused on infectious diseases and health, I want to touch on a couple of those topics, and I want to talk about some other stuff going on in Haiti that you have some expertise in. Let's talk cholera. Of course, since the big earthquake of 2010, hundreds of thousands of cholera cases have been officially recorded, and about 9,000 deaths. So far in 2016, we're seeing after seeing the numbers drop, in consecutive years, we're seeing it appears like they're increasing a bit. Dr. Carroll, what can you tell us about the cholera situation in Haiti in 2016?
Well, in 2016, there's actually been a rise compared to 2015 and 2014. Just in the first 6 months of 2016, there's a documented 25,000 cases of cholera, and that was just through the end of July with over 200 deaths. So I would think that the number of cholera cases would actually spike. And I think the scientists and the ones that follow cholera very closely would be telling us that after this horrendous Hurricane Matthew, that cholera will spike up again. And so by the end of the year, there should be, thousands and thousands of more cases. And the problem with cholera, Robert, as you know, is it doesn't take a rocket science to treat cholera or patients with cholera effectively. It takes some resources just with IV solution, IV tubing, and having it ready to go when the cholera patient arrives at the cholera treatment center. And so right now, these places are isolated. The hospital that I talked with today or texted today, they're isolated. And cholera hasn't hit there yet, but it can in the next week. And what happens when they run out of lactated ringer solution to give the patients? I mean, they don't have access to any right now. The main road going down to the big road down by Lacaille is blocked. And so IV solution is life-saving. So that isn't, the delivery is the problem with cholera in Haiti.
Now, back in 2013, I interviewed a specialist from Yale University, and back then, at least, they were really pointing fingers at the UN peacekeepers from Nepal as introducing cholera to Haiti, and apparently, Haiti was cholera-free for a century, from what I understand. And now, so many factors pointed to that. However, the UN and Nepal denied it pretty vigorously back then. As a matter of fact, when I used to write about this, I would get people from Nepal and the Nepal government sending me nasty emails concerning the articles I wrote. Anyway, UN Secretary General Ban Ki-moon recently apologized, not only for the cholera, but also for other horrible atrocities that were done to the Haitian people, including sexual abuse. And they're finally claiming some responsibility. At least it appears that way. Dr. Carroll, what are your thoughts on this? Why did it take so long for this to be acknowledged? And can they truly make up for it with, throwing support at Haiti now?
Well, the UN, I don't know if you can ever make up for the death of a human being.
Yeah.
And the UN feels bad about this. They accidentally introduced cholera to Haiti, 6 years ago, and they've admitted to playing a significant role in the outbreak. And actually, the Secretary General of the UN asked for $2 billion 4 years ago to try to help eradicate cholera from Haiti by improving the sanitation and the sewage systems in Haiti. But very little of that money has actually come in. And so the UN still could play a big role, depending on money and their incentives, to clean up the sanitation and the water supply and the sewer system in Haiti. That all has to be taken care of before you can really eradicate cholera from a country. And you don't ever probably completely eradicate it, but you can sure diminish it. Then there's different ways that the UN could help as far as prevention besides that, with rapid response teams, immunizations, and then the actual treatment of cholera in cholera treatment centers, which I'm most familiar with. You quoted some statistics at the beginning where there's been hundreds of thousands of people that have been infected with cholera, and the official numbers are, like you say, 800,000 or so, but I think the numbers are much greater than that, because most people with cholera just have either mild or moderate cholera and might not even know they have it, which would be some vomiting and diarrhea, and they get over it. So my guess would be that there's probably been millions of cases of cholera in Haiti, with far more than 10,000 deaths as well.
Sure.
So that's the story regarding cholera.
Yeah. So do you think that that this the cholera situation in Haiti is this something that's going to last for generations, or will we ever get a handle on it, I guess?
I don't know. I don't know enough about the epidemiology, let's say, of cholera. I know it comes in waves, but I think once a society has it, it's going to stay in that society for many years, some of it just perking along at a lower level rather than these enormous epidemics. But regarding the rest of the year here in Haiti, and in large part due to the underfunding of cholera programs, prevention and treatment, as well as with this hurricane, there will be many more thousands of cases of cholera in Haiti.
Yeah. All right. Well, let me ask you one more question, kind of related to that. I found a report online from the UN Dispatch, and they titled it "Haiti, Will We Get It Right This Time?" And of course, this was written right after the hurricane, and I'm going to quote from it: "Despite promises to build back better, we spent $13.5 billion on a relief effort that was slow, uncoordinated, and has led to remarkably little actual recovery. And we triggered Haiti's worst outbreak of cholera in recent history, killing thousands. Are we going to do better by Haiti this time? And has anything actually changed?" Dr. Carroll, are we going to do any better by Haiti this time?
I think we will do better this time after the hurricane now, compared to the earthquake 6 years ago. And the $13 million that you correctly mentioned was money that was pledged to Haiti. That didn't necessarily get to Haiti, but it was pledged. And it may have never left the donating country for that part. And then the money that did leave, most of it didn't get down to my friends in Haiti, the Haitians that I hang out with and work with in Haiti, in their neighborhoods and in the clinics in Port-au-Prince. The poor never really touched that money. And so let's say that you and I were given $1 million, Robert, to try to restore Haiti after the horrible earthquake. Well, if you hired all your American friends and I hired all my American friends and went down to Port-au-Prince and we paid them to clear some rubble, then we really didn't hire Haitians. That's and so the money kind of stayed in foreign hands, in our hands, so to speak. And we did some good with it, let's say clearing rubble or doing this or that, but we didn't create, let's say, sustainability and give Haitians jobs the way we should have.
Yeah. Now, let me ask you about help from other places. There's a lot of charitable organizations say that funneled a lot of money into Haiti. You were on the ground, Dr. Carroll. How well was that done, and who did the job well? As far as there's probably a gazillion different charitable organizations, but they probably all didn't do the same equally effective job. Who did you see on the ground that did a really good job?
The people that I worked with on the ground that I thought did a good job would be Doctors Without Borders, or MSF, Médecins Sans Frontières, and other NGOs such as Samaritan's Purse. They did a great job regarding cholera treatment centers that were set up. I've never worked with Partners in Health, but they've got a great reputation as well. So lots of NGOs did excellent work in Haiti. And if I give $1 to Haiti, I have to give that dollar to someplace I trust, someplace that's transparent.
Of course.
And, ideally we would be giving that money not to NGOs, but we'd be giving it to the Haitian government that confers rights on people. And by rights, I mean clean water and enough food and education and public health. But the trust in the Haitian government is not there by the world community, in my opinion. And right now, Haiti has an interim president. There haven't been parliamentary elections in about 5 years. And there was supposed to be another presidential election this Sunday, which was just canceled, or postponed, I should say, because of the earthquake. The Haitian people themselves don't believe in their government. And so when you don't have a functioning government, then you don't have an infrastructure, roads, clean water, sanitation, and things that we've talked about. You have to have the government to have the structure so a country like Haiti can withstand an earthquake such as Matthew, or can withstand, a hurricane such as Matthew, or an earthquake that we had 6 years ago. Robert, one thing I learned from the earthquake was that earthquakes don't kill people. Bad buildings kill people. So, and I really had to think about that a long time before I understood that. But, when buildings are made so poorly and people are crushed in the buildings due to lack of building codes, et cetera, it's really not the earthquake. This might be semantics in a way, but it's not the earthquake that did most of the damage. It's being in a bad facility. Most of the government, if not all the government buildings, fell during the 47-second earthquake in 2010. The UN building fell. The Haiti's #1 Catholic prelate fell to his death off a balcony, along with 140,000 other people that died in 47 seconds. So if there's not the structure in a society, if there's not the infrastructure in a society created by the government, then disasters such as an earthquake and the hurricane which we just had will be absolutely terrible.
Right. Well said. All right. Well, Dr. Carroll, I'm coming up on the hard break. Hopefully I can get you on the other end and we'll continue our discussion. Yes, sir?
Sure.
All right. Fantastic. All right. The website is outbreaknewstoday.com, outbreaknewstoday.com. And if you want to check out the website for Haitian Hearts, that would be HaitianHearts.org. HaitianHearts.org, and if you want to check it out, see what they're doing, if you can donate to them or just explore the website, feel free to do that. And after the break, we'll be back with Dr. John Carroll looking inside Haiti.
Welcome back to Outbreak News This Week, your source for all the news about worms and germs. Here's your host, microbiologist and editor of OutbreakNewsToday.com, Robert Harriman.
Well, welcome back to the show. Today's show, we're really delving deep into what's going on in Haiti. And I have an expert on here. He's been familiar with Haiti for 35 years. He runs the not-for-profit Haitian Hearts at HaitianHearts.org, and that's Dr. John Carroll. Dr. Carroll, let's go ahead and can tell my audience, the world right now is focused on Zika. I'm in Florida, and trust me, I hear about it on a daily basis. What's the Zika situation in Haiti?
The Zika situation in Haiti too is Haiti's faced with another epidemic, so to speak, regarding this virus, and the numbers that I've read have said that there's around 3,000 cases of Zika up until a couple of months ago. And whether this number is right or wrong, I have no idea. Zika is, as you know, a virus transmitted by mosquitoes, and it's linked to microcephaly and then mental retardation is secondary to the microcephaly, along with other neurologic disorders. So it's a very scary disease. A lady can have Zika and be pregnant and not even know that she's sick with Zika or infected with Zika, but the baby can be born with full-blown manifestations of Zika, or may be born normally and then as the months go by develop neurologic abnormalities from the Zika virus. It's considered a sexually transmitted disease, and just recently, as you probably know, the New England Journal of Medicine had an article where a 73-year-old man in the United States who had traveled to Mexico secondarily passed his Zika to a caregiver of his, and the 73-year-old man passed away. He had concomitant illnesses, but the Zika virus played a large role in his death. So it's a very, very scary virus.
Yeah, and how is Haiti prior to the hurricane, how is Haiti handling mosquito-borne diseases like Zika, like dengue, like chikungunya, and the like?
Well, in my opinion, not very well. Mm-hmm. Again, secondary to the infrastructure or lack of structure in the society. And people are on their own. 10 million people are kind of on their own, really, when they get sick. And their own immune system has to kick in and beat the dengue or beat the malaria or the chikungunya. And then even the Zika. Tests are frequently too expensive for the common person to afford. So, most people with Zika don't know they have it, and they get over it. And some are incredibly ill with it. So, so much of it is just due to the poor infrastructure and the statistics coming out of Haiti that we don't know as much about Zika as we should. Dr. Louise Ivers of Partners in Health has described it as a silent killer. Because it can be passed to, generally the fetus is what we're talking about, sure. And the mother doesn't even necessarily know that she's has the virus.
What other infectious and non-communicable diseases do you see as a major issue down in Haiti, other than what we've talked about already?
Mm-hmm. Well, that's a good question. And, in a general pediatric clinic where I work in Port-au-Prince, respiratory viruses are very prevalent, just that cause bronchitis and cause pneumonias in kids. There's a fair amount of waterborne diarrhea as well, whether it's salmonella, typhi, or shigellosis. Bacteria that cause diarrhea is very, very common. Parasites, roundworms are extremely common in Haiti. Giardia is common. Ascaris lumbricoides. We use lots of albendazole and mebendazole for Ascaris. So these are, I think, referred to as neglected diseases or diseases of the developing world that we do have up here some, but not in the huge quantities that we see in Haiti. Another thing too to consider that might be easy to forget would be skin diseases. I see so many kids with skin diseases, and by that I mean scabies and impetigo and ringworm. There's just a whole ton of different skin diseases. When kids live in the slum, they're living in a dirty environment. and their skin becomes infected and can do bad things.
So Dr. Carroll, when you're down there treating children, are you required to bring your own medications and all that? How does that work?
I work in the back part of City Soleil with the Daughters of Charity, and they have a large pediatric clinic there, and they buy all their medication that we use right in Port-au-Prince.
I see.
So it's local, basic antibiotics, antiparasitics, antifungals. That's all purchased locally. So I don't take any medication with me. They do have injectable antibiotics as well, ceftriaxone and gentamicin and ampicillin, which are invaluable antibiotics for babies with sepsis and serious bacterial infections. And, Robert, I might mention, on a busy day, we'll have 300 babies between the ages of just a few hours old till 5 years of age. We don't see kids greater than 5 years of age. And Robert, if I get a baby who doesn't look good, in other words, kind of floppy, feverish, lethargic, and the baby, more importantly, is in a bad position because I have to triage that baby to a hospital if I really want to take care of that baby the right way. And in other words, I can give the baby antibiotics in the clinic and then send the baby home and see the baby the next morning, but that isn't ideal by any means.
Sure.
And so when I get a baby that really looks septic, doesn't look good, I try to send the baby to a pediatric hospital or one of the general hospitals. But in the last 6 months, most of those babies have been returned to me because the general hospitals have been on strike. The strike is over right now, by the way. Or another pediatric hospital, for example, that I send the baby in Tabar, is overflowing with kids. They can't accept any more kids. And so they send the baby back to me, and I retreat the baby with antibiotics, tell the mother to go back to the slum, and bring the baby back the next morning. And so that's not ideal treatment, but it's the only treatment I can give in the situation that Haiti exists now.
How about what are you seeing as far as non-communicable diseases in Haiti? Is there any things that are a major concern?
It's a black population, as you know, so there is lots of hypertension. There is a lot of diabetes. There are a lot of strokes. And the hypertension can be extremely severe because it frequently goes untreated. It's not unusual for a Haitian woman to come in with a backache, let's say, and I'll check her pressure in her right arm, and it'll be 240 over 140. And that's not unusual at all. I seem to find more hypertension in women than in men for some reason. So you have the entire spectrum of disease that we would have here. There's cancer as well. Cervical cancer is the number one cancer of women in Haiti. It's very common. There's lots of childhood cancers as well. So there's a whole spectrum of disease. There's rheumatic heart disease too, which is caused by untreated strep throat.
Sure.
And we brought many of those kids home that can be adolescents that have a failed valve and are 14 years old or in heart failure, and they need their valve replaced because of rheumatic fever.
Okay, let's. I'm talking to Dr. John Carroll with Haitian Hearts, HaitianHearts.org, and we're talking about the situation in Haiti. And let's talk a little bit about the hospital infrastructure. Dr. Carroll runs a blog. It's called Dispatches from Haiti. It's really good, and I will link to it on my website. And you write here that Haiti has 25 physicians for every 100,000 people, and most Haitian physicians leave the country to practice. What do you have to say about that part of the hospital infrastructure, the shortage of physicians?
Well, there is a severe physician shortage in Haiti, and those numbers don't even really do it justice because most of the physicians are in the larger urban areas. And so someone out in the countryside, for example, is stuck down in the middle of the Southern Peninsula right now. They don't have access to hardly any physicians whatsoever. Haitian physicians, the ones that I know are wonderful. They are not paid like they should be. They're not treated how they should be. They don't have the facilities to practice good, up-to-date 21st century medicine. And so many of them leave the country. And I've always felt that primary care should be stressed. Infectious disease should be stressed in medical schools in Haiti. So Haiti can turn out physicians that are excellent primary care, infectious disease, pediatric physicians in Haiti, and stay in Haiti and pay them fairly and give them good environments to work in, good hospitals to work in. Specialists are great. We all need specialists at times, but you really need primary care physicians, family physicians, internists, pediatricians in Haiti, because most of the problems that we see during the course of the day are primary care problems.
Sure. Now, you were talking about the hospitals, and you write in the blog, Port-au-Prince has 2 large public hospitals and a few smaller public hospitals. They don't work too well. You wouldn't want to go there if you were sick. Mm-hmm. I mean, that's how bad it is, huh?
Right. It's even worse than that.
Yeah.
As a rule.
And you're talking about you're talking about the major city in the country too.
Right. Port-au-Prince is the capital, has 2 to 3 million people, and there's 2 main public hospitals that we would consider very dysfunctional for so many reasons. The structure, the sanitation, just the way it's set up. They don't work like our hospitals, and not enough money is put into the public hospitals around Haiti by the Haitian government to keep the hospitals afloat and keep them functioning to some degree for the majority of Haiti's poor. I would say that there's a little public hospital in Cité Soleil near where I work, and I remember when this hospital worked well in the 80s and 90s. And it's a public hospital, but it doesn't work well now, and one of the main reasons is the charges are too high for the average person in the slum to go to the hospital. To be seen as it equates to $2.50 U.S. A bed is $7.50. An admission is $7.50, and that doesn't make any difference if you're there for a day or 2 days or a month. It's still $7.50. Oxygen is $7.50, and we wouldn't think that sounds like maybe a lunch at McDonald's for us. But the people in the slum don't have $7.50. And so there's 300,000 people in the slum that are not getting care from this public hospital, which should work, and it's not working for the people.
That just sounds absolutely horrible. And speaking of horrible, I want to go to another point that you mentioned in dispatches from Haiti. It's concerning infant mortality, and you say Haiti has the highest infant mortality rate, under 5-year mortality rate, and maternal mortality rates in the Americas. And the next sentence is really the kicker. It says, you write, having a baby in Afghanistan is equally safe.
That's true. The maternal mortality rate in both countries.
That is terrible for a country that's only a couple hundred miles away from the tip of Florida.
It's absolutely terrible, as you say. And right now, in the Southern Peninsula, I read a statistic today that there's 60,000 pregnant women. 60,000, and they're essentially isolated from the rest of Haiti right now. They're stuck in their own villages. They're up in the mountains. They're down at the seaside. They've lost their homes. 60,000 women going to have babies at some point within the next 9 months. You asked about the long-term effects of this hurricane. How's that going to play out?
Exactly. So, Dr. Carroll, what's the answer?
The answer
is there an answer? Yeah.
Well, yes, of course there is an answer.
Okay.
It's a good question, but there is an answer. And in my humble opinion, and I really mean humble opinion here, Haiti can be saved, so to speak. Haiti can be helped by Haitians and by a Haitian government that takes care of its people. And the international community can help if we help in the right way. We don't want to prop up the wrong people or the wrong organizations. The international community can play a role, but it has to be a correct role. So the Haitian government confers rights on people. An NGO like Haitian Hearts, like us, we don't confer rights. We identify a kid with a heart problem, bring him to the States for heart surgery. That's not going to save Haiti. That will hopefully help that child. But the Haitian government has to kick in. Haitian politicians have to kick in for the 10 million good Haitians that need their help.
Yeah. Now, you talk about some other points in here, at least as far as health, that only about half of Haitian kids, less than 2, have their vaccinations.
Yes.
Clearly, that can't be good.
No.
Yeah. And concerning education, apparently the education system down there is not optimum. What can you say about the education system, Dr. Carroll?
Well, most of the kids of the 10 million people at the bottom of the ladder would have access to the public school system, and the public schools are not what private schools are. They're not as good, and it's more of a rote memorization situation in the public schools. And these kids have a hard time passing the proper tests in order to get into high school if they have the money to get into a high school. And I think it's easy to forget too that many of these kids that are in school, which is 50 or 60% of the kids are actually in school, they've walked a long ways to get to the school that day, and they're tired, and they might not have had any breakfast, and they might be anemic as well. And so their ability to stay attentive in class and stay awake in class is diminished. If the teaching isn't what it should be, their education is diminished as well. So there's a long ways to go regarding education as well. Haitians are incredibly smart people, and they can learn lots of things that I can't learn very quickly.
Sure. But
they have to be in the right environment with the right nutrition, with the right teachers to do that.
Yeah, of course, I've worked in different clinical laboratories in Florida, and I worked with, quite a large number of Haitians since I've lived down in Florida, and they're fantastic technologists. So,
yes.
And I guess the last thing I want to ask you about is I want to give you some time, a few minutes, to talk about Haitian Hearts and the work that you do, and you have the floor, sir.
Well, first of all, thank you for allowing me to talk with you on the show, and your questions are so perfect. They're open-ended when they need to be, they're closed-ended when they need to be, and I just appreciate you caring about Haiti and your audience caring about Haiti as well. Haitian Hearts is our not-for-profit organization we started about 20 years ago, and what it is when I'm in the pediatric clinic in City Soleil or wherever I'm working, if I run across a baby or a child or a young adult with a heart murmur or with an obvious heart problem, what I try to do, Robert, is diagnose that problem in Haiti and get an echocardiogram in Haiti, and then find a medical center in the United States that will accept that baby, that child, that adolescent for heart surgery if they're a candidate for heart surgery. And what I mean is, if they're a candidate, is I have to get the child, the patient, at the right time. It can't be too early where they're not sick enough, and it can't be too late where they're too sick, or they've got pulmonary hypertension, or they've got too much damage done to their organ system from a bad heart where you really can't operate on them other than to do, let's say, a heart-lung transplant. So they have to be right in the middle and a good candidate for surgery. So then I start the search, looking around the United States for frequently a pediatric medical center that will review the echocardiogram and hear the history and physical. And if they're accepted, then we work on the passport and the visa to bring the child to the United States for heart surgery.
Fantastic work. So I take it the hospital is picking up the tab for the surgery, or is Haitian Hearts paying for it? How does that work?
A little of both.
Yeah.
If we can help out, we do. We've donated over $1 million to for inpatient surgeries in the United States. Frequently, hospitals will just do the surgery pro bono, as well as the physicians. They'll do it without charging us. So that's the way it works.
Fantastic. All right. Well, I want to thank Dr. John Carroll with Haitian Hearts for filling us in on what's really going on in Haiti. And you can check out the website again at HaitianHearts.org. Thank you, Dr. Carroll. I appreciate your time, sir.
Thank you, Robert.
And God bless the work that you do, sir.
Thank you, sir.
All right. Well, I'm looking at the Weather Channel website, and they have a list of different charities if you want to donate to help out in Haiti. And their list includes the International Red Cross, World Vision, the Salvation Army, UNICEF, Operation Blessing International, Food for the Poor, Mercy Corps, CARE, Direct Relief, Catholic Relief Services, Save the Children, International Medical Corps, Global Giving, Concern Worldwide, Handicap International, and Samaritan's Purse. And I will put a link to that up on the website when I publish the podcast. And I want to thank Dr. John Carroll, a man that clearly has a love for the Haitian people. And I appreciate his taking the time to spend the hour with me on the show. I want to thank Ace for running the operation. And I want to thank you for listening. And I will see you next week on Outbreak News This Week. Good night. God bless.
Thank you for listening to Outbreak News This Week with Robert Harriman. If you missed any part of today's program, you can listen to the podcast anytime on our website, OutbreakNewsToday.com. Make sure to join us here next week for Outbreak News This Week with Robert Harriman.